We're glad to spend some time with Dr. Stephen Marsh, who we meet with during the lunch hour, but he also will show up here on WKYC during the Today Show on Sundays around 8:25. Doctor, it's good to see you again.
Thanks. My pleasure, Joe.
Well, we're getting to the end of the year, and there's probably viewers watching right now that they should consider something about dental care. You have a great suggestion for all of us.
Well, so near the end of the year, and we have this happen in our office, people come in and they may have some dental benefits that are remaining. Sometimes they have an HSA account. Neither carries through to the next calendar year. So if there's a time to start and you want to use up the money that you have towards this, you can come in. We can't get everything done because many of the cases that we do involve quite a bit of planning. But whatever we can do from a restorative standpoint or some minor crown and bridge work, we're glad to do it and get them started at this point.
When things take a little longer, you're referring to implants and veneers, right?
Yeah, that's one of the things. Sometimes bridges, and in those cases, Joe, I'm just going to show you, this is a wax prototype. So before we enter into those cases, we want a very predictable result. So we'll have our laboratory work with us to create this wax prototype so the
Wow.
patient knows what they're getting and we know how to approach it in the most effective manner. And I'm going to show you some of those patients. And Joe, we've got 5 patients, all who start with the letter J, just like Joe. So
Okay, let's go.
you ready? I'll
Roll
start
call.
going. So
Who's
this
this?
is Jay. This is John, one of our first ones. I had restored his teeth with some porcelain veneers and crowns about 6 months before. One of the teeth had fractured. We had planned to do an implant there. You see an implant post in the before picture, zirconium. In the after, you see him restored with a
Oh,
porcelain
wow.
crown that went on the
Perfect.
post, gave him a beautiful smile and one that he's very, very proud of.
Gorgeous. Really is.
Thank
All
you.
right.
Our next
That's
patient,
John.
John. This took lots of planning to tell you, not to tell you the truth. All of this is to tell you the truth.
Right.
We did a wax prototype. His wife dragged him in. He said, you know, he's in his 60s. He wore his teeth down. They shifted. They turned dark. He wanted a beautiful smile as he went into retirement. In his case, not the end of the year. A lot of planning. We did all crowns and veneers on the front, made them look as if they were straight. Was not an orthodontic candidate. Loved it. But again, this took quite a bit of time till we could get this accomplished, but he loved the result.
All right. We had 2 Johns. Who's the next guy? John, and
John. So John was an attorney,
okay.
3 Johns. He had worn his teeth down over the years. Joe, in order to restore that, we actually had root canals done. We put some posts in those front teeth to give him a little strength, to give him this beautiful smile. We did 10 porcelain veneers. He said he felt much younger, and his wife really loved the smile. And then she said she'd like her turn as well.
Okay, now we can't have
Four
John
Johns?
again,
No.
can we?
No. So our next patient is actually Jackie. She had a
Which
split
which
between
is a
her.
derivative of John, so very good. All right.
Very good. So over the years, her teeth had spread. She was going to a family reunion. She's in her 80s. Her daughter said, I want my mom to take care of herself. She brought her in. We did 6 porcelain veneers, reshaping of the teeth to give her that beautiful smile. She said she was the star of the reunion.
That's fascinating. The fact that you can move the teeth, so to speak, without any braces or anything like that.
Yeah, if
That's
I had
just
my druthers, we would. But on an 80-year-old who has a reunion coming up, we needed more time. Our last patient is a woman named Joanne, another J. She had
wow.
broken off some teeth. We reshaped the bottom. We gave her some porcelain bridge work, zirconium. It's very strong. She said she feels about 20 years younger.
Mm.
I wouldn't doubt it. What a difference in her. And she said she feels so much more confident and feels so much better about herself. Again, took a lot of planning, 2 months, 3 appointments to give her that beautiful smile.
Well, I'll tell you, with the year end coming on the calendar, and if you want to get on the calendar here with Dr. Marsh and his team, even if your name doesn't begin with J, and if it's not John, Jackie, or Joanne, you can call up Dr. Marsh at 440-461-1003 or log on to the website. It's a really, really awesome website with more of these pictures too and testimonials. It's awesome. It's clevelandsmiles.com. And Doctor, thank you so much for spending some time with us. We appreciate it. Coming from a guy named Joe, I appreciate it.
It's been my pleasure always, Joe. Thanks.